Hello and welcome to the Womxn Show. I'm Lenina Rassool and today we are speaking about women's health, specifically digging into two conditions, endometriosis and polycystic ovarian syndrome, more commonly known as PCOS. After the break, we are going to be joined by Dr. Carmen James, who is an integrative doctor and health coach, and she's going to be taking us through these two conditions. But before we go, we're going to have a look at two explainer videos from her YouTube channel to take us into the conversation. Let's have a look.
Period pain is not normal. A small amount of discomfort or bloating or tenderness in the lower pelvis when you are having your period is considered normal. But if you're having pain, especially if you would say that your pain is greater than or equal to a 5 out of 10 in intensity, this is definitely not normal and a sign that you need to get tested to determine what the cause of your period pain is. Some common causes of period pain include things like endometriosis, fibroids, inflammation in the pelvis like PID. All of these conditions may contribute to experiencing pain and discomfort in your pelvis. If you are experiencing pain that is interfering with your daily life, if you're missing school or work as a result of your pain, or you are unable to participate in social activities because of it, get help. That is not normal. If you're looking for some natural ways to approach period pain, check out the link in my bio and you'll find there the Pain-Free Periods ebook with a bunch of tips and advice that you can start implementing today to improve your next period. What causes endometriosis? Well, the exact cause of endometriosis is still unknown, but there are a few theories about how it develops. The first one is that endometriosis occurs because of the backflow of menstrual blood through the fallopian tubes and into the pelvis. Another theory suggests that endometriosis is caused by dysfunction in the immune system or from hormonal imbalance. It is also thought that genetics may play a role in the development of endometriosis. Follow along in the series to learn more. 5 steps to get you started on your PCOS healing journey. Step 1 is to know your PCOS type, and there are 4 PCOS types. Step 2 is to get tested. Ask your doctor to do the relevant tests to crystallize your diagnosis and better determine your PCOS type. Number 3, set some goals. Make sure that you know exactly what you want to achieve so that you know once you've achieved it. Step 4 is to get started and start gaining momentum. Start implementing the steps that you can take for your specific PCOS type so that you can start to see results and stay motivated to continue going. And step 5, make sure you follow the 6 lifestyle areas that you need to focus on in order to achieve sustainable results. Like and follow for more.
Those were two short videos explaining endometriosis and PCOS. We are going to take a short break, but we'll be back with more after this.
Welcome back. You're still watching The Womxn Show, and today we are speaking about women's health and specifically the still taboo topics like periods, fertility, and endometriosis and PCOS, which I personally don't know a lot about, and that's why it's important for us to have this conversation. And joining me in studio is Dr. Carmen James, who is an integrative doctor and health coach focusing on women's health and also has a very cool YouTube channel called Dr. Carmen James. Carmen, welcome and thank you for joining us.
Thank you so much for having me. It's an honor to be here.
Yay. I'm so excited for this conversation, but like I said, I don't know very much about endometriosis and PCOS, but I'm seeing a lot more narrative emerging around it, and I think we need to start with, what are they, both of them, and is there a difference?
Absolutely. So that's a fantastic question and a great place to start. And I'm very happy to see that more people are talking about these topics because it's so important for us to be educated about these. So there is a difference between the two. Perhaps let's start with endometriosis. Endometriosis is a condition where every month when you have your menstrual cycle, the lining of the uterus starts to develop in preparation for the baby, right?
Yeah.
So the egg gets released from the ovary and it makes its way through the fallopian tubes to get into the uterus, hoping that it's going to get fertilized and make you pregnant. But when that doesn't happen, then you have your period. But the influence of the hormones in your body cause that lining of the uterus to grow. Now, in endometriosis, what happens is that lining or cells that are similar to the lining of the uterus start to grow outside of the uterus. And that's a problem because your body's hormones are causing that lining or that tissue that's similar to the lining to thicken and grow. And under the influence of certain hormones, that lining is supposed to shed. But the problem is, if the lining is outside of the uterus, it has nowhere to go.
Oh, wow.
And so it basically starts to bleed and causes scar tissue. And so what happens in endometriosis, these patches of tissue outside of the uterus act almost like glue inside your pelvis. And they start sticking things together. So it can attach to your ovaries, it can attach to your uterus on the outside, it can attach to your bowel, to your bladder.
Oh, no.
And so with endometriosis, a lot of the symptoms are centered around pain because that scar tissue can be very painful. And also, depending on where that tissue attaches, you can get other symptoms. So if it attaches to your bowel, perhaps you may have things like constipation or pain when you are using the toilet. Maybe if it attaches to your bladder, you could have difficulty or pain when passing urine. So by and large, the main complaint for people with endometriosis is chronic pain. And it's really pelvic pain, but it also depends on where that tissue attaches. PCOS is a completely different condition and an often misunderstood condition. PCOS stands for polycystic ovarian syndrome. And really, when things don't really make much sense in medicine and it's just a bunch of symptoms together, we kind of just call them a syndrome.
Yeah.
So PCOS is one of those conditions where there's lots of different symptoms. But basically what's happening in PCOS is that women are not ovulating. And when you're not ovulating means you're not releasing that egg. So it means that you'll have less periods. Your periods will happen less frequently. So you have longer time frames between the periods. And also what happens in PCOS is that the levels of male type hormones, what we call androgens, like testosterone, perhaps you're familiar, will start to increase. And so people with PCOS tend to have symptoms tied with that link of high androgens. Abnormal hair growth on the face, hair loss on the top of the head. Women have acne, they gain weight. Some people really battle with fertility because in both endometriosis and PCOS, because you're not ovulating as frequently. And it's a misnomer, the name, polycystic ovarian syndrome, because some people do have cysts on the ovaries, but you can actually have PCOS even if you don't have cysts on your ovaries. So it's not one of the things that you have to be diagnosed with this condition. But both endometriosis and PCOS really can affect your quality of life. And they definitely can both affect your fertility rate. And certainly in endometriosis, the pain is a problem. And with PCOS, perhaps it's the other symptoms that are associated with the condition that cause more.
Thank you so much for that explanation. I mean, that was great, and they actually are a lot different than I thought. I think people probably rope them into sort of the same basket a lot of the time. I want to ask you, I think, about endometriosis first, and let's look at that, and let's look at this chronic pain that you talk about as a major symptom. I know that when we speak of, periods are still very taboo to speak about, but one of the things that people say about painful periods is that historically we were just told that pain is part of your periods, that's what's normal, regardless of how heavy it is. And a lot of times I think people have said, even their own mothers will say that. I'm going to leave it there. So some way I read that actually chronic pain with periods is not normal. And so just open that up.
Absolutely not. You're right. And I think for a long time we've been told that period pain is just a normal part of being a woman, just deal with it, And certainly in endometriosis, occasionally in PCOS, we'll get to that in a moment, but in endometriosis, certainly the pain is probably the most overwhelming symptom. Now, I always say that period pain is not normal. A mild level of discomfort when you have your period, a little bit of discomfort, bloating, feeling uncomfortable, sure, that's fine. But the moment you're experiencing pain, if you look at the pain scale, if you would grade your pain more than a 4 to 5 out of 10, that is not normal. And I think shifting and changing that narrative that period pain is normal is so important, because it's part of the reason why so many people go undiagnosed with this condition, because they believe that what they're experiencing is just part of life. And, there's a statistic that says that it takes on average 8 years for somebody with endometriosis to be diagnosed, because often it's not just them who thinks it's normal, as you said, the family, the boss. Right? Booking time off work because you have period pain. Really?
Yeah. Big debate, right?
But then also the medical fraternity. Oftentimes people will go to the doctor and say, I have a really painful period. And we know that often women, especially when they complain of pain is often underestimated.
Yeah.
And oftentimes women will leave just being put on birth control, being given some anti-inflammatory.
We underestimate our own pain. Often by the time we go to the doctor,
it's extreme. You've left it for so long that now it's becoming really unbearable. You've popped all the painfuls that you can. You've done the hot water bottle. You've done everything that you possibly can in your own capacity to solve the problem. But certainly period pain or pain during the menstruation is a feature of endometriosis. However, people with endometriosis often will have pain regardless of the period. So chronic pelvic pain almost every day in some instances. Pain on intercourse, big one. And oftentimes an embarrassing symptom that women don't like to talk about. But if you're having pain on intercourse, red flag. That's a big problem. Regardless of whether it's endometriosis, pelvic inflammatory disease, or something else, if you're having pain on intercourse, that is not normal. And so I think that when it comes to really being honest and being clear with the fact that if you're having pain, especially if it's outside of the normal, especially if it's outside of the time frame, an occasional painful period here and there is one thing. But if you're in pain all the time, it's important to speak to your healthcare practitioner and discuss that, because it could be a sign. I always say that symptoms are your body's language. It's the way your body tells you there's something wrong. Oftentimes you'll have a headache and you just pop a pain pill so the headache goes away. But why do you have the headache? Your body's trying to communicate something with you. Maybe you're tired, maybe you're dehydrated, maybe you've been looking at the screen for too long. Maybe you're too stressed or too anxious. But we oftentimes medicate the symptom without paying attention to why we have the symptom in the first place.
Yeah.
What is the root cause of this symptom? And that's why it's so important for us to not ignore the language of our bodies. And when your body's telling you that something's wrong and it's giving you the signs, it's so important to pay attention to that.
I love that. You're medicating the symptom without thinking about the root cause. And we do that. We do that often. I want to ask you, we're talking about it can take up to 8 years to get diagnosed. And I think, just under the umbrella of both endometriosis and PCOS, I think one of the studies that I did also, that usually it only gets diagnosed at a point where people are seeking help for infertility or for not falling pregnant.
Yes. And oftentimes, as you're saying, the pain, I can deal with the pain. I just have painful. But now when I want to have a baby, that's often the time where people will go to the doctor and say, hey, something's wrong with me. Not realizing that the signs were actually there for a long time before you actually were having challenges with conception. But yes, when it comes to endometriosis and PCOS, fertility is often the point at which we start digging a little bit further. Again, when it comes to diagnosing endometriosis, it's not an easy condition to diagnose. It's really based on the symptoms. So as we've said, those pain syndromes and that kind of thing. But also it's based on quite an invasive test. It's typically not, that invasive, but it does require you to go to theatre. It's called a laparoscopy, where they put cameras inside the abdomen to visualize and see those patches that I was talking about of abnormal tissue outside of the uterus. That's how endometriosis is diagnosed. Now, can everybody afford to get into an operating room to get a diagnosis of endometriosis? Often no. And if you look at the public healthcare system, you're definitely not going to get into theatre for a laparoscopy to diagnose your endometriosis. It's not going to happen, because there's a waiting list of people who require gynecological surgeries that are considered a lot more important, life-saving, than diagnosing endometriosis.
And it's just in period pain.
That's it.
Yeah.
So just, pop the anti-inflammatories and take birth control and get on with life. And so there are many challenges around this issue of how and why are we having these delays in diagnosis. And even when the diagnosis is received, oftentimes people feel overwhelmed with, okay, now what do I do? Right? What are my options?
Yeah.
And oftentimes you'll find that people with endometriosis end up going back into theatre several times, because one of the ways that we treat endometriosis is by getting rid of those patches of that tissue. And oftentimes it's burned or removed. Yes. And unfortunately, we know that once you get into the abdomen, you get scar tissue. And we said that part of the reason why people with endometriosis have pain is because they bleed and have scar tissue in the first place. So every time you have another surgery, it's basically the cycle of inflammation and scar tissue that keeps going on and on and on. And the treatment oftentimes can perpetuate the disease.
So it's a bit of a
catch-22 situation, which is why addressing some of the underlying things and the lifestyle things potentially that we could do to help to relieve some of the symptoms becomes so important. Because oftentimes people with this condition are at a loss because they feel like, I don't want to go back into theatre. What are my options?
Before we get into options actually and how to treat it, I want to circle back to PCOS. So we've spoken a lot about endometriosis. It seems, from the original description that you gave, as much as it's dismissed or not recognized, it seems a bit more obvious in the PCOS in terms of the chronic pain, a little bit more legitimate because of the chronic pain. With the PCOS, we're also saying, both of these things disrupt the quality of life.
Yes.
Prior to fertility, what are the ways that PCOS can show up in someone, before they try to have a baby and think, something's not right, and go in and find out that there are hormone imbalances and issues. How does PCOS show up in sort of normal life?
So one of the most common ways that PCOS shows up is with weight gain.
Okay.
So what often happens is that about 70% of people with polycystic ovarian syndrome will have something known as insulin resistance. And insulin resistance is basically like a pre-diabetic state. It's where your body stops using insulin effectively. And so maybe if I can just quickly say that, when you eat a meal and you've got some carbs in the meal, it gets broken down in your body, turns into sugar. Now, your cells need that sugar to do the things that cells do. But we don't need that sugar in your blood. So when you digest the sugar, it ends up in your blood, but we need it in your cells. So in order for the sugar to get from your blood into your cells, it's almost like your cells have a lock on them, and somebody needs to come with a key and unlock the cells to allow the sugar in.
Okay.
And that key is insulin. So insulin unlocks the cell. It allows the sugar inside the cell to do what cells need to do.
No one has ever explained it like that before.
Easy way to think about it, right? But what happens in insulin resistance is it's almost as if somebody put bubblegum in the lock. So if somebody put bubblegum in the lock, the key would go in, but it probably wouldn't open that door. So what happens is your body thinks, hey, hang on, the sugar's still sitting in the blood, it's not getting to the cells. How do I get more of that sugar into the cell? I need to make more keys. So it starts to make more insulin. But the problem is not the insulin. The problem is that there's bubblegum in the lock. So your body starts making more keys and more keys and more keys, but those keys are ineffective at opening that lock. And eventually your body becomes resistant to those keys. So those keys stop working. And so in the meantime, all that glucose is building up inside your blood. And when that happens to a threshold, you get diagnosed with diabetes. But before that, we call that insulin resistance. And so 70% of people with PCOS will have insulin resistance. And what happens in insulin resistance, insulin drives fat production, makes you gain weight. And oftentimes people will go to the doctor and say, I'm not eating that much, but I'm blowing up. I'm gaining so much weight. Or it's difficult for me to lose weight. Often the doctor will say, you just need to diet and you just need to exercise. Not realizing that under the surface, this person actually has insulin resistance. And so commonly, people with polycystic ovarian syndrome will complain of weight gain. They'll complain of difficulty losing weight. They'll complain of what we call central obesity, that like tire, that mukaba fat that sits around.
Yeah, the donut.
Yeah. They'll complain of, or maybe they won't complain of, or maybe they won't even notice. But commonly, insulin resistance will give you things like skin tags. You have little patches of dark skin that start to develop everywhere. Some people even have a darkening of the skin behind the neck or under the arms. All these are signs of insulin resistance. And associated with that, you may have things like acne. You may have abnormal hair growth, hair loss on the top of your head. And then, of course, symptoms of a missing period or long periods of time before you menstruate again. What we say long menstrual cycles. So if your period is coming, if you're having your period within more than 35-day cycles, so from day one of the first period to day one of the next period, if that time is more than 35 days, then we would say that that is a long menstrual cycle. And that's a clue for us that perhaps you're not ovulating. And when you're not ovulating, then part of the reason why is because insulin resistance affects your ovary's ability to ovulate. And so that's often the constellation of symptoms, or the reason why people who go into the doctor is to lose weight, or to have a baby, or their period's constantly. And so typically, if you have a doctor who's awake enough to kind of put that together, then you may start to get tested for PCOS. It's a little bit easier, I'd say, to get a diagnosis of PCOS than endometriosis because it doesn't involve invasive surgery, it doesn't involve you going to theatre. But again, because PCOS is just a group of symptoms, sometimes actually getting the right tests done and putting them together to get the diagnosis of PCOS, sometimes it just doesn't work out like that.
And I think, thank you for that. That was great, really. And I think, what's important to pull out of what I'm seeing also here is the presence of not just a single symptom, but a cluster of symptoms. And so often, as we're speaking about it, you're going in there with like, oh, there's one thing wrong, but being able to recognize that actually, look at these symptoms and recognize that there are a number of things wrong and that's important in order to get a proper diagnosis.
Yes. And if you think of the amount of time you get to spend with your GP, how many minutes do you typically get?
15.
Okay. And if you come in there with like a shopping list, your doctor's going to say, no, just tell me like what's the problem? Like what's that, And so oftentimes as the person seeking help, you feel pressure because you don't want to feel like you're wasting the doctor's time. And at the same time, the doctor's got a waiting room of like 50 people that they need to see. Yeah. But at the end of the day, again, it comes down to these symptoms are telling you something. And
Carmen, this is fantastic, but we need to take a short break. We will be back with more after this. Welcome back. You're still watching The Womxn Show, and we are having a great conversation around women's health, specifically looking at periods, we're looking at endometriosis, we're looking at PCOS and what it is. And joining us still in studio is Dr. Carmen James, who is giving us the 411 or 101 on what these are. And Carmen, before the break, we said a lot. We spoke a lot about what these two conditions are, about the cluster of symptoms, about how they disrupt life and what they can look like. The last question I think we were speaking about, we sort of veered into treatments, but we didn't go into it. And I think I want to start with endometriosis. And just because, we've got the chronic pain, we've got the symptoms of chronic pain, it's tissue growing outside the uterus, and you mentioned that diagnosing it can be quite invasive with a surgical procedure, a laparoscopy.
Yes.
But that's so you said that's why it's so difficult to diagnose, and also the difficulty with access to these types of surgical procedures. But where does that leave us then? That's why we said that's why women feel so lost sometimes. Where does that leave us then? We've got these symptoms. We suspect it is our doctor. Let's say we've gotten to a point where the doctor also suspects, yes, this is it.
Yeah.
Then
So when it comes to treatments medically and what you can do about your symptoms, there are a few things, but it's not a lot of things that you can do, unfortunately. Okay, so we said in endometriosis, the main problem is pain. We have the fertility issue, but we can start with the pain. So oftentimes, medically speaking, we would use things like pain medication. And oftentimes people are prescribed, whether it's simple paracetamols or anti-inflammatory medications. Really, when pain is really extreme and severe, it can require the use of stronger pain medication. And really, when we're talking about endometriosis, oftentimes these people will have flooring pain. You'll be on the floor, in the fetal position, struggling to even get up.
Yeah.
And so in those instances, some people really do require very heavy pain medication. And there's a whole discussion about, the effectiveness of that long term, but also the potential for relying on that medication and having dependence on it and the complications of that. But so symptom control with regards to pain. Then we have, let's speak about the laparoscopy, which we said is a diagnostic tool, but it can also be used as a treatment tool. So essentially a laparoscopy is a procedure where small incisions are made on the abdomen and cameras are inserted in to have a look and see, are there any signs of this tissue anywhere? And if the tissue is found, oftentimes in the beginning it will be biopsied so that it can be diagnosed.
can I also? It's not something you can look at through an X-ray.
So unfortunately, because endometriosis tissue, it's like, it's a soft tissue.
Okay.
So if you did an ultrasound,
Mm-hmm.
you would see it.
Oh wow. Okay.
If you did an MRI scan, you probably would see how expensive is an MRI scan.
Yeah.
And then oftentimes, it comes down to access and what your medical aid will not pay for.
Mm.
And so difficult to visualize it using radiology.
Okay.
And that's why it oftentimes requires that surgical procedure to actually spot those lesions. And that's, again, why it can be so difficult to diagnose. And then let's say, for example, we see those lesions and we can biopsy them to confirm that it actually is endometriosis. And then in that laparoscopic procedure, it's at that point where those lesions could be removed, or what we would say ablation, which is basically where we cut off the blood supply to those lesions so that they eventually just shrivel up and disappear.
Okay.
So that's the surgical option. The other option is for medications that will help to bring balance back to your hormone. So one of the things that happens in endometriosis is that we have a dominance relative to progesterone, a dominance of estrogen. So estrogen, progesterone, your two hormones, making you develop your reproductive tissues, controlling your menstrual cycle, but they play different roles in the menstrual period and menstrual cycle. And so what can happen oftentimes in endometriosis is that you have this dominance of estrogen. So estrogen is like the bully.
Okay.
She's there, she's feisty, she's taking over the show, she's like calling the shots. And oftentimes when you have high estrogen, things like pain, heavy bleeding, etc., bloating, all the PMS symptoms, that kind of a collection of symptoms follows. And so what's happening is that progesterone is like, we refer to it as the pregnancy hormone. It's a very calming hormone. And the reason why it's referred to as the pregnancy hormone is because when you ovulate, when you release that egg, progesterone is actually released from that crater that the egg leaves behind of the ovary.
Okay.
And so that progesterone's pumping out of the ovary, hoping that you're going to get pregnant, keeping that lining up. Yeah, let's get this baby. And then if you do get a fertilized egg, eventually the placenta will start to develop and take over the production of progesterone. So really progesterone's there to make sure the lining of the uterus is nice and cushiony and friendly and welcoming for the growing baby.
Oh wow. My pregnancy took away both my high blood pressure and my depression for the duration. Right.
And that speaks to the power of the calming effect of progesterone. That's often the reason why when people go through menopause, start ovulating,
Okay.
progesterone goes away, they get anxious. Oftentimes people in menopause will complain of how anxious they are. And that's because progesterone is no longer there to calm you down.
God, we are learning so much today. Like so much more than just endometriosis and PCOS. Okay, go on.
I'm happy. Yeah. So because they lack progesterone relative to estrogen, and estrogen dominates for various reasons in endometriosis. But because of that imbalance of estrogen and progesterone, oftentimes that's what makes the symptoms worse. So the medication that we can use to try and alleviate some of those symptoms is a synthetic progesterone, or what do we say, progestin. And oftentimes those medications, they're not contraceptives, they are hormones, synthetic hormones. And the reason why we give them in people with endometriosis, a common one that's used is known as Vazan. The reason why we give them in endometriosis is to boost the effect of progesterone, to balance out that excess of estrogen. And so commonly we would give that for a period of about 6 months or so.
And how does that affect the tissue outside of the endometriosis, the tissue?
So the tissue is responding to estrogen.
Even though it's outside.
Yes.
Okay.
And that's the key, is that even though it's outside of the uterus, that fluctuation in your hormones that makes your menstrual cycle, that tissue is responding to the estrogen. It's thickening in the same way that your lining of your uterus is thickening during those periods in your cycle. It's bleeding when you're having your period. That shedding process is happening outside of the uterus in response to those hormones.
Oh, wow.
And it's estrogen really that's driving the way the tissue is behaving. And so when you increase the effect of progesterone, you're balancing out that estrogenic effect on that tissue. And so it can help with reducing the size of those lesions. For some people, it can actually cause those lesions to disappear completely. It can also reduce things like pain, reduce your chances of getting more lesions, improve your fertility potentially, give you a better quality of life. The problem is, it's a synthetic hormone. And synthetic hormones have side effects. And so we worry about the risk versus the benefit when it comes to deciding whether or not we give this medication. Some of the things that we worry about in particular are things like blood clotting. These are serious side effects that could be potentially life-threatening. Deep vein thrombosis, pulmonary embolism, which is clots in your lungs, heart attacks, strokes. These synthetic hormones, including birth control, potentially increase your risk for these things. And so this is why, again, it becomes so important for us to really take a step back and understand, well, what's going wrong in the body? And yes, we do have medical and perhaps surgical options, but what else can we do to help relieve some of these symptoms? And, your health and well-being, yes, it's based on your genetics, but I think oftentimes we place too much emphasis on genetics. And we think, it runs in my family, because endometriosis and polycystic ovarian syndrome generally tend to run in families. However, just because you may have a certain set of genes doesn't necessarily mean that you'll actually experience the disease process associated. There are a number of lifestyle factors that we actually, and this speaks to having agency over your health. It's not necessarily that, you're at a dead end at a catch-22, there's nothing you can do. There's a lot of things that we can try and do in the lifestyle to alleviate some of those symptoms. And that's the thing that many people don't know, don't understand, because they're not told this by their doctors. Oftentimes, the doctors don't learn about this at medical school, so it's difficult for them to educate on these things.
Can I say, so when I was first diagnosed with high blood pressure, and I remember, and I didn't want to think about being on medication for the rest of my life. I was still very young.
Yes.
And I remember I asked him, what would it take for me to get off?
Yes.
And he said, you need to have certain lifestyle changes and be healthier and stop smoking. He's like, but people don't want to hear those things. So we are resistant to the lifestyle change. We're not going to go into that and how difficult those things are. Yeah. But that's sort of what you mean, right?
Yes. And it is more difficult. I will 100% agree. And not only is it more difficult, but we like this, like a microwave generation, right? So you put your food in the microwave, 2 minutes later it's hot.
Yeah.
And that's what we want. We want instant results.
Take the
headache tablets, I want my headache to go away.
Yeah.
We want immediate gratification.
Oh.
And oftentimes with the lifestyle changes, whether that is, what are the dietary things you can do? What are the exercise things you can do? Stress management, getting better sleep, detoxing, taking supplements, whatever those kinds of things. Or taking certain herbal supplements or whatever the case may be. It's a long game. And so a lot of people don't commit to that journey because they feel like it's overwhelming. And really, it can be overwhelming if you think that you have to do 25 things in order to get, relief of your symptoms. But when we really look at it and when we really break it down, just choosing 3 things that you can commit to for a period of time, we see that people see incredible results. And that's why more and more people are now speaking about this publicly on social media, sharing the experiences, how I reversed my PCOS symptoms naturally. People are sharing, things, herbal supplements or things that they've started including in their lifestyles that have really worked for them. And I think the bottom line and important thing to remember is that what works for them may not necessarily work for you, but you are your own experiment.
Yes, and probably, if it's these sorts of healthy things, for instance, you're going to get better in some way, shape, or form anyway. Right, in some way.
And your body's going to talk to you and tell you that.
Yeah.
And you're going to notice either, if I eat this thing, my pain gets worse. Or if I eat that thing, my pain actually gets better.
That's it. I just want to, and so can there also be there are things that can make it worse and can make it worse, let's say. Would you suggest, and again, looking at low cost, easy things people can do at home, I'm a big fan of tracking. So start keeping a food diary,
and a period diary.
And a period diary. Yeah.
Because a lot of the time, I always say the period that you have today was made in the month leading up to that period.
I like that.
So what you were doing throughout that month, leading up to that period, that's going to influence how horrible or how effortless that
the periods are the same. Yeah.
And that's another misconception that we have, is that every period. But if you're stressed out more this month than you were last month, your period's definitely going to tell you that. You're definitely going to experience more inflammation, more pain, more discomfort, more moodiness, more bloating. And a common thing that people say is like, oh, but life is stressful and I have a stressful job, a stressful home life, or, all these things are out of, and it's true. We do live in a very stressful world. Life is stressful for most of us. But ultimately it's about, okay, but now what can I do to kind of manage that stress? Because I may not be able to avoid it altogether, but what can I do, even if it's 5 minutes, of just taking a moment out and saying, can I do a few deep breathing exercises? Can I just shift myself from that stress constantly overdrive to a bit of a more restful, more quiet? Because surprisingly, even that 5 minutes of just taking a time out and breathing, it seems like impossible that it's going to make an impact, but it really does. And now we're starting to see the science to back that up.
So I've had one of the things, and I think I've said this in a previous show. One of the things that I went to doctor. She gave me this prescription to walk. She said you just need to walk with no earphones. Just go on this. It doesn't have to be fast or whatever. Just go for a walk. And so after, and I understand I am privileged to be able to do this in terms of my schedule. So I don't work like sort of normal 9 to 5 or 8 to 5. But after I took my daughter at school, I got to get very slow at the park. And I have noticed very visible changes, just even in that day, just even, again, how I respond to certain things physically. And so that is, we have 5 minutes left, and I haven't asked you about treatments for PCOS. And I don't know if some of that advice in terms of the health, etc., is the same and can be carried over, because getting healthier broadly will help us with everything.
Yes.
But is there anything specific we should know in our treatment with PCOS?
Yes, so absolutely the lifestyle things, all of that can be easily transferred over to PCOS. But again, because we said that insulin resistance for a lot of people with PCOS is going to be a bit troublesome, one of the things that we can really hone in on is focusing on keeping our blood sugar levels stable. And that is something that can take you a very long way if you have polycystic ovarian syndrome, especially if you're battling with insulin resistance, resistant weight gain, and difficulty losing weight. Oftentimes, like we mentioned with endometriosis, hormonal medications are prescribed. Mm-hmm. And commonly in PCOS, the pill is prescribed to regulate the period. And I just want to touch on that because I feel like that is a very common misconception that we have, because the bleeding that you have on birth control is not a period. And so by giving birth control to people with polycystic ovarian syndrome, you're actually not regulating anything. We're masking the imbalance and potentially even making it worse. So I would strongly encourage anybody who has been offered birth control for any period problem, really weigh up the pros and cons for you and make an informed decision about whether or not you actually want to go that route. Because really what the birth control is ultimately doing is it's masking those symptoms. It's not getting to the root of the problem. And so definitely I would say for PCOS, blood sugar stability is vitally important. And then there are certain supplements that you can actually take that have been shown to be very effective with not only supporting blood sugar stability, but also improving your chances of ovulating. And one of those supplements is inositol. So I would definitely recommend that anybody with PCOS and insulin resistance focus on the blood sugar and consider a good inositol supplement as well.
I love that. You know, sometimes we might have a fever and be very, and it's something I did somewhere. So when I'm giving her the fever medicine, it's just treating the fever right now, and then you have to wait and track about whether it comes back, how badly it comes back. But it's not really, it's treating the symptoms, right? It's making me extremely nervous.
Yes.
Carmen, we need to take a short break, another short break, but we'll be back with more after this. Welcome back. You're still watching The Womxn Show, and we are speaking about women's health. And still with us in studio is Dr. Carmen James, who has been telling us all about endometriosis and PCOS, and we have learned so much. Thank you. I wanted to, you know, we're playing out with some last words, and I think one of the things that I wonder about, this is also a topic that has been spoken about widely by celebrities, and always, you know, like Serena Williams and her birth story and not being listened to by doctors, you know, has come up. Other, even, you know, and that's also speaking about Black women and their bodies and health issues, but even coming up across sort of race and demographics. And so when we look at something like this, which is very difficult to sort of first identify and then diagnose, and then going into a doctor's office, whether it's your GP or whoever else it is, and being told, no, that's nothing. And it does happen. I just want to acknowledge on the show that that might actually happen depending on who you're going to and whether that person, how much that person knows about endometriosis or PCOS. So when we talk about agency, when we talk about knowing there's something wrong but nobody will listen, it's just a sort of open-ended question. What do we do with that?
So that is a fantastic question, because there are so many people who that is their lived experience.
Yeah.
And I think that it's important to go back to what we were saying earlier about symptoms are your body's way of communicating with you. And you know your body best. Yes, the doctor may have the head knowledge and the education from medical school, but if you feel that there is something wrong with you, getting to the root of what it is should be your mission. And whether that means getting a second opinion, whether that means doing some of your own research. Nowadays, we have so much access to information. oftentimes Dr. Google tells us we're going to die tomorrow. So it's important to have a measure of just be conscious of making yourself overly anxious when that may not be the best thing for your health in that moment. But doing your own research and finding people who perhaps have shared experience.
Which is great with Facebook groups now.
Absolutely.
You can compare sort of experiences.
Yes. And nowadays we have access to allied health professionals that may not necessarily be a doctor, a GP, or maybe even a gynecologist, but there's things like health coaches nowadays. If you're having an issue, perhaps that's a little bit difficult to diagnose. Sometimes with these chronic medical conditions, things don't always fit neatly into diagnostic boxes.
Yeah.
And so whether that is seeking the assistance of another health professional that could perhaps guide you and give you some feedback, and whether that is getting a concrete diagnosis or not. Perhaps it's just about listening to your body and, again, experimenting on yourself, trying certain lifestyle interventions and seeing what works for you, keep that, and what doesn't work for you, let that go. And so I think a lot of the time we get very tied up in, what is the diagnosis, doctor? As opposed to what's happening with me and what am I feeling, what's going on, and what could I do to potentially help myself feel better. Of course, we know that, in certain instances, they're red flags. They're conditions that, if you're experiencing certain symptoms, you need to go and see your doctor. If you're experiencing symptoms, perhaps, of a stroke, for example, we don't expect you to go and Google and say, how can I fix this symptom?
Although people do.
People do.
Yeah.
So there has to be a measure of, being realistic. But if you're experiencing symptoms, you're struggling to get to a diagnosis, nobody seems to be listening to you.
Yeah.
I would definitely encourage you to seek help and support outside of just not getting the diagnosis from your doctor.
Can I ask you, so I'm thinking, just back to what we were saying about sort of keeping a period diary, sort of keeping a health diary. And, I think I myself have been guilty of going to my GP and saying, I think this is wrong with me because Google said this and this and this.
Yes.
But in cases like this, with these sorts of chronic diseases that are very difficult to diagnose, is it a good idea actually to, start identifying? Is it a strong point to come from being able to go in and say, over the past month, I've checked, my symptoms, or over the past 6 months, I've checked my period, and, here's a pattern of chronic pain, or, do you think it's a good idea?
Absolutely. And I think in this day and age, when we have access to things like health apps and that kind of thing, it's so easy for us to do that.
Yeah.
But even if you don't, just keeping a diary of, even a food diary is so helpful. Even if that means that you're not necessarily discussing that with your GP, but perhaps you're discussing it with a nutritionist or a dietitian. Keeping track of what's happening with you is the ultimate way of knowing when things are working and when things are not working. And oftentimes when it comes to getting into a doctor's office, we already said, you get 15 minutes, that's it.
Yeah.
So coming in with your records and saying,
your personal health records.
Exactly. Yeah. This is what's been happening with me, and this is for how long, and these are all the symptoms that I have. Being prepared in that way, and also be confident about asking questions. If there's anything you don't understand, if a doctor wants to do a test that you don't understand why they want to do the test, ask about that. If you don't understand what your diagnosis is, don't be afraid to ask questions about that. Treatment-wise, if a doctor wants to prescribe medications to you, it's important for you to ask questions and also ask about other alternatives if you don't choose to go the medication route. So I think that's so important for us to speak up for ourselves and don't be afraid to find other help from other places, but also ask the necessary questions if you need clarity on anything.
Thank you. I love that. I love just the sense of agency, because sometimes going to a doctor is like going to the hairdresser and you're afraid to pull them out and ask questions or even ask a second opinion, right? So, Dr. Carmen James, You also have a YouTube channel, which is great because that's how we found her. And it was like, I need to have this woman on the show to speak about this topic. So can you tell us how can we find some of your material where you speak about these topics too, right?
Yes. And so I'm very passionate about speaking about all things health and wellness, but also have a very, very strong passion for women's health. And so you can find me across all platforms. It's at dr.carmenjames. Or you can check out my website, drcarmenjames.com, if you want to book a consultation or learn more about integrative medicine and health coaching.
Okay, fantastic. So now we know how to find you, and that brings us to the end of our show. Thank you so much for joining us.
Thank you so much for having me. It's been awesome.
Yay. And that's all we have today. Thank you for joining us, you two. And we will see you next week. Goodbye.